Hello, dear friends! Today we will talk about traumas, their characteristics, and first aid to the victim in different traumas. There are different types and classifications, but today we will discuss only the mechanical traumas. Trauma is a violation of the tissue and organ functions as a result of environmental factors. They are quite common and occur in awkward or unexpected movement, a sharp blow, fall, bruise, car accident, etc. Mechanical injuries include bruises, dislocations, sprains or ruptures of ligaments, ruptures of muscles and tendons, bone fractures. A contusion is damage to tissues and organs without disturbing the skin's and bones integrity. Dislocation is a complete or partial displacement of the articular surfaces of the bones. Dislocation more often occurs in the shoulder, less often in the hip, elbow, and ankle joints. Sprains and tears of the joints ligaments arise as a result of rapid movements that exceed the joint's physiological mobility. Also, the reason may be a sharp foot twisting, for example in case of an unsuccessful landing after a jump, a fall on an arm or leg. Such injuries are more common for an ankle, knee, and wrist joints. Fracture is a complete or partial violation of the integrity of the bone. Fractures can be closed and open. In a closed fracture, the skin remains intact. An open fracture also has a wound. It is more dangerous because there is a risk of infection or blood loss. Although the origin of mechanical traumas can be different, their clinical manifestations are very similar. The main signs of trauma: sharp pain when feeling the site of injury, swelling, inability or limitation of performing regular movements, discoloration of the skin at the site of injury, deformation of the limb, a feeling of crunching in the bones or clicking sound at the time of injury, external bleeding. When providing first aid, make sure you are safe. Assess the victim's condition, consciousness, and breathing. Provide rest to the victim. Call an ambulance if necessary. If there is a wound, stop the bleeding with any proper method. Apply clean tissue or bake a bandage. Do not set a limb that looks unnatural or dislocated. Apply cold to the injury site if possible. The cooling process should not exceed 15-20 minutes at a time. If the ambulance arrives quickly, do not move the victim. Suppose you do not expect a quick arrival due to particular circumstances. In that case, the transportation of the victim or his transfer is possible only after the injured limb's immobilization. Immobilization creates a stable position of the traumatized limb with improvised means of special transport splints. Handy items such as folded blankets, towels, scarves, boards, cardboards, folded magazines, etc. can be used as a splint or fixation bandage. As well as a damaged arm can be attached to the body, an injured leg can be attached to a healthy leg with laying a soft material between them. Applying the splint, do not move the injured limb or change its position. In fractures, at least 2 joints should be fixed, one below, one above the injury. If there is a large bone fracture, such as the shoulder or hip, fix 3 joints. Let's look at a specific example. For example, it is necessary to fix 3 joints, the humerus, the ulnar, and the wrist, in case of a humerus fracture. When applying a splint, in order not to increase the pain, you should first model the splint on the healthy side and apply a finished splint on the injured limb. We use a ladder splint or one made from improvised means, cardboards, plywood, from a board, a stick, etc. If the fracture is closed, apply the splint right on the cloth, after wrapping it with a bandage, a towel, a soft cloth, and covering the body's protruding parts with cotton wool. In case of an open fracture, do not apply a splint to the places where the bone protrudes outward. It is necessary to use a tissue to the wound or a bandage before applying the splint. If possible, the splint should be applied on the limb side opposite to the open wound. Finish your action by fixing the splint in 3 or 4 places. Before and after splinting, check the blood circulation in the injured part of the body. You can ask a conscious victim if his fingers of the injured limb are numbing. Touch his fingers. They should be warm to the touch and have a pink color near the nails. If he feels numb, loosen the bandage. Again, do not put the splint if the ambulance arrives quickly. In the case of femoral fracture, we fix the next 3 joints: hip, knee, and ankle, using the same technique as in humerus fracture. Head and spine traumas are the most severe injuries which can cause death. It is possible to assume that the victim has a head or spine injury if there was a traffic accident or a fall from a height. The victim looks drowsy and lethargic, or loses consciousness. Does not remember that what happened. He has a severe headache, nausea, or cramps. Feels pain in the neck, back, or pain when touched. He has a lack of sensitivity and mobility below the damage. Suppose you identify one of the above signs. In that case, you need to act as follows. Check your safety, assess the victim's condition, consciousness and breathing, calm down the victim and convince him not to move. Ask someone to call an ambulance. If no one is around, do it yourself. Before the ambulance arrives, it is necessary to fix the victim's cervical spine with hands or improvised means. As improvised means, you can use clothing, jacket, sweater, etc., wrapping them around the neck. The edges of the collar should tightly support the head. That will prevent squeezing of the neck's soft tissues and organs. If the victim is nervous and restless, do not keep his head and neck motionless against his will. It could harm the victim. Always remember, the displacement of the damaged cervical vertebrae can lead to severe consequences up to the cessation of breathing and blood circulation. Spinal injury is also hazardous. During the first aid, limit the mobility of the spine. To do this, the victim must always be on flat, rigid horizontal surface, for example a shield or a board. If the victim is not in danger, do not move him. There is still a possibility of additional injury to the spinal cord. If the situation is not safe and you need to move the victim, then move him with the help of several people. As mentioned before, pay special attention to fixing the cervical spine. To sum up, today you learned what a mechanical injury is, what traumas are related to mechanical injuries, and how to provide first aid to the victim.